Welcome back to another episode of This Month in Health. I'm Liz Ortiz. This month, the month of December, is Seasonal Affective Disorder Awareness Month. Seasonal depression, also known as SAD, is a form of depression triggered by the changes of seasons. According to the American Psychiatric Association, about 5% of U.S. adults experience SAD. Joining me now to talk more about seasonal depression and ways to combat it is Dr. Stephanie Hargrove, clinical psychologist and assistant professor in psychiatry and behavioral sciences at Duke University School of Medicine. Dr. Hargrove, thank you so much for your time today.
Thank you for having me.
Of course. So I want to start out with understanding seasonal depression. For those who may not be familiar, what exactly is seasonal affective disorder?
Okay, so seasonal affective disorder is not its own diagnosis. It is a subtype of a major depressive disorder with a seasonal specifier. So, what that means is you wouldn't have this disorder diagnosed separately outside of having a major depressive disorder diagnosis. So, with that major depressive disorder diagnosis, if there is at least 2 years of a seasonal pattern to the depression. And usually we see the seasonal pattern showing up in the winter months, so usually starting in the fall and ending in the springtime, mainly during the winter. If we see that recurring for at least 2 years, then you might meet criteria for seasonal affective disorder.
Good to know. And how common is it? I mentioned that 5%, but what does that really mean in the grand scheme of Americans in this country? How common is it and who's most at risk here?
Yeah, so the folks who tend to be more at risk are those who already have been dealing with various mood disorders. If they've also had other experiences of either depression or anxiety disorders or even bipolar disorder, there might be some changes in mood that come specifically with seasons. This is something that is I would say like fairly prevalent, but not something that everyone is going to experience. And just to put that out there, that there might be a range of experiences that people have with seasonal affective disorder. So there could be more severe experiences of it and some sub-threshold types of experiences where people might experience something like the winter blues, and it might not meet criteria for a diagnosis, but they might experience some changes during the season. So that's possible as well.
And, we talk about the change in seasons. Obviously, we just had the daylight saving time change. So now it's getting darker much earlier. I found myself yesterday, doing things around the house, and I'm like, it's only 6 o'clock. What do I do now before I, get ready for bed? So I know it throws people. So talk more about how this time change and how the season change, rather, affects a person's mood and why so.
Yeah, so it's very interesting. So one thing that we know for sure with research around this disorder is that the change in light and the change in exposure to natural sunlight can decrease serotonin levels. So serotonin is, associated with balancing mood and helping people have that kind of mood boost and energy. And so if serotonin levels are lower, they're not getting that natural mood boost. And the other part of it is that with the change in light, people also experience increased melatonin. And the increase in overproduction of melatonin can lead to increased feelings of being sleepy and lethargic. And so then, when you have the combination of decreased serotonin and increased melatonin, there tends to be a disruption in circadian rhythms. And our circadian rhythm is basically our 24-hour clock in our body that kind of helps us with sleep and wake cycles and helps us kind of just regulate throughout the day. And if that's thrown off, now we might be sleeping more, we might have a harder time adjusting and regulating our mood and sleep schedule on a regular basis. And so that can really, the light change and the decrease in exposure to natural light can really change those neurotransmitters and the way that we experience that functioning in our body.
It seems like it's sort of this ripple effect. And I think the time change was about 3 to 4 weeks ago at this point.
Mhm.
How long does it take to even adjust? because I feel like with almost a month later, it's still kind of an adjustment of just trying to find that balance.
Yeah, it can vary from person to person, but I will say that oftentimes it's the light change, the whole winter can be a disruptive time period, especially for those who are dealing with seasonal affective disorder, and it really doesn't remit until it gets into the spring. And now I will say there is another type of seasonal affective disorder that is a spring into summer type. That's a lot less common. Most people experience it during the winter months, and then you see remission when it gets warmer and the sun is out for longer periods of time. However, there might be a reverse effect in the spring and summer months where people experience seasonal affective disorder. Again, it's much less prevalent, but people experience usually more irritability, some like withdrawal, and just increase in agitation and anxiety around that time. So that's another form of seasonal depression or seasonal affective disorder.
And I know you talked about winter blues. You hear that often. And then, of course,
Mhm.
seasonal affective disorder, seasonal depression. From your standpoint, I know you know the difference, but say, any other person who may not know what they're feeling, at what point can they tell the difference between winter blues and seasonal depression?
Yeah, so winter blues tends to be less severe, right? So the seasonal affective disorder, which is the depression subtype, is going to mimic depression symptoms where somebody is experiencing sad mood, low energy, lack of concentration, just an overall diminished motivation and energy level, and people might be more tired, have trouble sleeping. That experience is a major depression's experience as a whole. And so that's kind of on the more severe end and would be classified as seasonal depression if there was a seasonal kind of rhythm to it. So if for 2 years in a row, at least, you're seeing that during the winter months, you experience that depressive episode, and then it remits during the summer and the lighter months. And so for those who have winter blues, it might be change in like maybe feeling a little bit more sad, maybe isolating more, or having trouble sleeping during the winter months. But it's not necessarily rising to the level of a full-on depressive disorder. And those winter blues tend to be very common for folks. And so we see that more often than not.
So, really paying attention to the time overall, how this affects you year to year.
Yeah.
Okay. So if someone starts to notice those symptoms that you mentioned, what would be their very first step? What should they do if they notice this?
Yeah. So, first off, if there are any symptoms, whether it's mild, moderate, or severe, you want to know what you can do to get help. And it's always recommended to reach out for help from a medical or psychological professional. And so, therapy can be a helpful remedy for winter blues or for seasonal affective disorder. But also, there are a lot of other strategies that people can do just at home to kind of start addressing those changes in the light exposure that they're getting and changes in the season. One thing that has been proven effective by research is light box therapy. And so people actually, if they're not able to get out into natural light on a regular basis, can actually have a light box that produces enough daylight, kind of mimicking lumens that will actually help people experience the serotonin levels that they need. And so, light box therapy is something that's recommended.
And talk more about other things or habits we can do, simple things we can do at home, even to
Yeah.
help our mood and kind of boost our energy and just give us an overall boost during this time of year when things do kind of feel more gloomy and get dark earlier and that sort of thing.
Yeah, absolutely. So, one thing I would say is staying active. And the best way to do this is if you can go for a walk, if you can get outside. One thing is you will get more of the natural sun exposure that would be helpful for this time of year. The other part is that active exercise helps with improving endorphin levels, and that can be a mood boost for folks. I would also say, as much as possible, keep a routine, help yourself. And remember, when I talked about the circadian rhythm can get thrown off, if you don't keep a sleep schedule and a wake schedule, it can be even more difficult to adjust to these changes in the seasons. And so keeping a routine for yourself can be very helpful. And then also staying connected and just making sure that you have social interactions and engaging activities, whether that's things that help you like get up and moving or just connect with people. It could be online forums and games, or it could be meeting up with people in person. But all of those things can help with treating the depressive symptoms overall, staying active, being connected, feeling like there's meaning and purpose and reward to your activities. And then also being able to do some of those things out in the sun can help with that, those serotonin and melatonin levels.
And speaking of the sun and getting that sunlight, is there a good time of day that maybe you want to get outside more so than others, or really just at any point of the day when the sun is up?
Any point of the day when the sun is up, I mean, if you can get out midday when there's like the peak sunlight, that would be great. But also just if you can get any kind of sunlight, whatever works for your schedule, that's great. That's a great start.
And I know too, I saw a video where you talked about some tips about, combating this, going out for a walk and get the sun at the same time. So you kind of kill two birds with one stone.
Absolutely. It does both at the same time. So it's a great way. That's why, like, being able to take a walk, whether with friends or with coworkers or just around your neighborhood, that can help do many things at one time. One, getting you sun exposure, getting you some exercise, and maybe even social connection.
And how can friends and family members support someone if they notice that maybe they're dealing with these sort of symptoms? What can we do as friends and family members, loved ones?
Yeah, first off, I would say check in, right? Just ask the person that you're seeing dealing with this, what they need, how you can support them. Maybe you could be the workout partner, right? Maybe you can hold them accountable to those things, or you could, help them find a good therapist in their area. So I would check in first and see what it is that they feel like they need, and also be willing to kind of join them in this journey, even if it's not particularly your need to get out and be active as much as they might need it. Being willing to kind of join them in that pursuit could be very helpful.
Are there any other tips to combat SAD other than getting the sleep and getting the sunlight, staying active, staying social? Any other tips you would give to people?
I would say the other thing is that outside of getting professional help in therapy, the other evidence-based treatment would be antidepressants. And so, if it gets to a certain point where, therapy or your own activity isn't really helping, then talking to a psychiatrist or a licensed provider who can help you decide if medication is the right move for you could also be another strategy. But outside of tips, just mainly staying active, getting in the sunlight, having a routine, helping your body recreate and stay true to that rhythm that it needs to keep you sleep and wake in the right cycle every day.
I will say, just personally, even last night, for example, 6 o'clock, it was dark, and I was almost ready to go to sleep at that point.
Yeah.
What can I do? What can anyone do who's kind of in that same pattern where it's like it's dark, it's 6:30, but it's too early to go to bed? What can I do to sort of keep myself moving until at least 9:30 when it's actually bedtime?
I would say your best friend is planning ahead,
Yeah.
having something for you to do. So maybe you switch your gym routine from the morning to the evening, or maybe you have an activity planned, or you're going to make dinner at a certain time. But knowing ahead of time that, hey, the sun is going to go down, I might feel more sleepy. sooner rather than later. What can I do to make sure that my body knows when it's time to sleep, when it's time to wake? And it's not so, bad as a whole to feel a little bit more sleepy when the sun goes down, but it's more so if you're noticing that this is really shifting your habits and in really getting in the way of your overall functioning. If you're not able to like engage with family and friends, if you're withdrawing, if this is getting in the way of work, then you really want to make sure that you're paying attention to those symptoms and getting help. But before then, it's really just making sure that you know ahead of time, hey, this is what I'm going to do in these evenings, even though the light has changed. What can you do inside? What can you do with a light therapy to help kind of replace some of the light that's missing? Things like that can help.
I'm curious too, does nutrition at all play a role in this and sort of how we can boost our energy and our mood as well?
So nutrition is not necessarily, there's not specific evidence that links the nutrition changes to improvements in seasonal affective disorder. However, a change in diet can be helpful for mental health overall. So it's a great way for folks to, if you want to pay attention to, the kinds of foods that you're eating, making sure you're getting nutritious full meals and healthy foods for you, that can be a boost for any mental health condition and can improve mood overall.
So, really, just a combination of a lot of different things to sort of keep your energy up this time of year.
Yeah, absolutely.
All right, Dr. Hargrove, we're going to take a quick break right there. And then when we come back, we'll talk more about treatment and ways to reduce the stigma of seasonal affective disorder and really any other ways people can combat this. So, we'll take a quick break. We'll be right back. Welcome back to This Month in Health. We continue the conversation with Dr. Hargrove about Seasonal Affective Disorder Awareness Month, which is this month, December. So, Dr. Hargrove, I want to jump back into the conversation about combating seasonal depression. I know we touched on this already, but can we talk more about when a person should really decide to talk to a mental health professional? When is the best time to really say, hey, maybe I need to get some assistance with this?
Absolutely. So I would say when you notice that your symptoms are getting in the way of your daily functioning, when you are not going to work, or if you are hindered from doing your work, if you are hindered from activities as normal, if you notice that you are no longer feeling interested in the things that you used to enjoy, if you're noticing that you're in bed more often than not and you have a very hard time getting out of bed every day, those types of symptoms are more severe and they indicate that your overall functioning has diminished. And that means that more likely than not, you will need help from a professional. And it would be a good time to reach out to a therapist or to a psychiatrist.
And when you do finally reach out to a psychiatrist, a therapist, you speak with them. What would sort of be the next steps in terms of a treatment or a plan? And I'm sure it's
Mhm.
from person to person, of course. Anything that is more effective than others.
Right. So it would depend on the person, but I will say that in terms of seasonal affective disorder, there will be a time of assessment to see, okay, what type of rhythm does this depressive disorder take on, right? And determining does it meet criteria for the diagnosis or not. And if it does, then the psychiatrist might consider an antidepressant and might have a conversation about how the antidepressant might help during this particular season. Otherwise, cognitive behavioral therapy is a very helpful therapeutic tool, often within the subset of cognitive behavioral therapy, there is behavior activation that is a specific treatment for major depressive disorder. And depression has been effectively treated with behavioral activation. And it really includes a lot of the same things that we were talking about earlier, which is finding ways to be active, to get out of bed, to have more connection, to have more experiences that are rewarding, and that help you build mastery. And so all of those things would be kind of, you would get a guide and direction step by step from that medical professional or from that mental health professional to help you work through whatever is coming up in terms of the depression symptoms.
I do want to go back to one of the tips you gave earlier, which is to stay socially connected. Can you go more in depth about why it's so important to stay connected with friends or family and just sort of have
Mhm.
that sort of community during these winter, fall months?
Absolutely. So the thing is that depression often, people, when they're experiencing depression symptoms, they tend to withdraw, they tend to isolate. And the biggest thing that helps folks kind of get out of that cycle is being able to have people that they can talk to, interact with. Oftentimes, when you're more connected, you experience more meaning and you feel more like a sense of purpose, and a sense of the connectedness can really help you feel less isolated and alone. And so, because there's such a prevalence of being more isolated and alone with experiences of depression, we want to really make sure that people have that feeling of connectedness and feel like they are not actually alone, that they have people that they can talk to and relate to during their time during this winter.
And I know you mentioned earlier for friends and family loved ones to check in, simply just check in. Any other
Mhm.
advice you would give to friends or family members to sort of make sure the people in their lives are okay?
Absolutely. I would say, keep in mind that you don't have to be their therapist and you don't have to be their medical professional, right? It's important to be there, right? Being present is huge. Just showing up for people, being willing to meet them where they are, that can be such a difference maker for folks. But if it gets to the point where people are having a really hard time and you don't know how to help them, it's okay to ask for help outside of yourself, to go to a medical professional, go to a mental health professional, because you don't have to solve all their problems for them. The best thing that you can do is be a supportive presence and continue to be there for them.
And I want to talk about research. I know research is ongoing. I'm curious if there's anything in terms of SAD right now in research, any exciting things kind of down the pipeline when it comes to seasonal affective disorder, and that could give hope to those who may be struggling with this.
I will say research does help us understand that one, this disorder is highly treatable. So doing the therapy where you're getting more active, getting antidepressants, having light therapy, all of these things can be really helpful. And often you do see those remissions within the different season changes. So overall, this is a highly treatable disorder. And the other thing is that there's new research happening every day. People are looking into vitamin D deficiency and how that might impact mood changes, how that might improve seasonal affective disorder symptoms. And so, right now, there's not a proven relationship, but there has been some more research exploring how vitamin D might be able to help supplement some of the deficits that people might experience during that time. So there's a lot of people looking into this, and there's a lot of hope. This is not something that people have to endure forever. There are a lot of strategies and treatments out there that could be very effective.
And I'm curious when it comes to this, what is your hope with seasonal affective disorder? What is your hope long term for this
Mhm.
and those who struggle with it?
I hope that folks will learn more and become a little bit more aware, right? Not to over pathologize, in the sense that we don't want everybody to think that when they have the winter blues, that means that they need to be on medication or that they have to be in therapy. So I would love for folks to have more awareness about this disorder, and also recognize that if they have it, that there's nothing to be ashamed about, that there's really a lot of ways that people can get help. And so, really, I'm hoping that there's decreased stigma in reaching out for help, and that there's increased awareness so that people know what they're dealing with.
And I'm curious too with SAD, are there any common misconceptions or myths that you hear about this in particular that maybe you would want to clear up for people?
I would say sometimes it can be easily dismissed
Mm,
or overemphasized. And
right.
so on either end, I would say we have to be cautious, right? So where it's overly dismissed is like, oh, you just have the winter blues, like it's gonna pass, you'll be fine, right? And if you're not paying attention, missing the fact that this is a major depressive disorder could lead people to being in a severe state where they're not getting the help that they need. But then on the other end, if you're overemphasizing this and anytime you feel a little bit tired during the winter months or anytime you're feeling a little bit sad or isolated during the winter months, you're saying that you have this disorder and that
Mm,
everybody has this disorder, then it again can really hinder people from knowing when it is appropriate to have that diagnosis and not, and also make people more fearful and honestly feel like there's something worse happening than it is. There's a lot that can be done. And so I think having an appropriate view based off of the research is really important.
great. And as we wrap it up, any one final message or encouragement that you would give to people who, may be struggling this time of year, what would you say to them?
I would say there is hope. There are so many strategies, and the first step is reaching out to your community, to the people around you. And if you don't know what to do and you think that you're really struggling, then feel free to reach out to a professional and know that there are proven treatments that will be helpful. And there's hope, right? That this does not have to last forever. This is something that can remit and that can be treated well. So don't be afraid to ask for help, and you're not alone in this.
Yeah, important to know that there is help out there. Dr. Hargrove, thank you so much for your time. Such an important topic, but I think we've got a lot of great information here to help those who may be struggling this time of year. So thank you again.
Wonderful. Thank you.
Alrighty, and that'll do it for this episode of This Month in Health. I'm Liz Ortiz.